Good morning. I am Beverly Hutcherson. I am the manager of diversity inclusion for UW Health / SMPH, and I am really excited to introduce our speaker for today. She is truly internationally recognized, a superstar, a icon in our community. I am a huge fan. She's also the bestie of my supervisor, Shiva Badar Saloff. And just to be able to hear what she's going to say, which is critical given the times we are living in and the work that she's been doing tirelessly. But I'll go to her formal bio. Raised in Mexico City, Dr. Tellez-Giron received her medical degree with honors at the National University of Mexico. Moved to the United States in 1993 to be with her family to continue her education. Ever since, she's been working very actively in the Latino community in Madison, Wisconsin. As many immigrants, she moved without anything, started over from cleaning houses. Do you hear that? A physician starting over cleaning houses to take care of senior citizens while she's doing the steps to become a physician in the United States. It took her almost 4 years to complete all the necessary requirements. She completed the University of Wisconsin Family Medicine residency. As soon as after graduated, joined the faculty of the same program and is now an associate professor. Her clinical practice is at Wingo Clinic, where more than 90% of her patients only speak Spanish. She has been the chair of the Latino Health Council in Madison for the past 25 years. Under her leadership, several annual community initiatives have been started, including the Latino Health Fair, the Latino Chronic Disease Summit, Latino Mental Health Summit, and the Latino Teen Bash. For the past 17 years, she has been the medical director and main presenter of a monthly health education Spanish radio program in the local Spanish radio station. Dr. Tellez-Giron has received multiple awards. Just to name a few, the University of Wisconsin Outstanding Woman of Color Award, the 2011 City County Reverend Dr. Martin Luther King Jr. Humanitarian Award, the University of Wisconsin School of Medicine Faculty and Staff Equity and Diversity Award, the 2016 Arnold P. Gold Foundation Humanism and Medicine Award, was featured in Time Magazine, 27 People Bridging the Divides Across America, and most recently in 2022, the Medical Society Foundation Superhero Award, and in 2023, the UW Health Leadership Physician Award. When I say she's an icon, I'm not just saying it. She has mentored so many people of so many backgrounds, and she is so beloved, including by me. I have such great admiration for her. So I will turn it over to Dr. Patricia.
Thank you. What a presentation. Thank you, Beverly. I hope I live up to the expectations. So I'm going to start sharing my screen. And okay, I did it. I didn't know. And you can obviously hear me, right?
Yes.
Okay. So I'm going to go very quick. The topic today, obviously, we could be talking here for months, but I try to summarize some of the most important points that I think are going to be for you as a kind of audience. And we're going to try to do a very, very quick trip to things that are going to be very important for you to provide care for our population. As it was mentioned, right now, things are really difficult and up in the air of what is going to happen with many of our brothers and sisters that are here in the United States, not only for the undocumented ones, but even, for us that have been here for a long, long time. I'm gonna let you have these. Actually, the presentation should be available for you so that you can have the full presentation, but I'm just going to highlight a few of the things quickly so that we can allow time at the end for you to ask questions. So why is that we are talking about this today? Because we are now the largest underrepresented population in the United States. And it's calculated that by 2050, we're going to be about 24.4 of the populations. It's interesting how what you see in the news is, about our unfortunate, undocumented brothers and sisters that are here in the United States that are probably about 12 million people, but actually the majority of the Latine people in the United States are actually American citizens. We're talking about 50 plus in here. And the other very important part on this slide is that we are very young and we are going to represent the population that exactly is going to start, populating more this country. And obviously, the kids that are being born as of today are going to be American citizens and eventually are going to have voting rights as well. Here in Wisconsin, the population has grown enormously, and the birth rates are higher for the Latine compared to the non-Latine. So that is something, again, when we were talking about the growth of the population. And we are calculated to be about 8.1% in the state, and then in Dean County, about 6.1%. And 44% of the people actually living in the county were born already in the United States. So when many years I was asked to start doing these presentations, it was very interesting because I would be asked to talk about folk medicine and evil eye and, other things that we have as folk medicine. However, I don't know that I remember the last time that a patient of mine came and asked me about evil eye or having a spell. What I see every day for the past 28 years that I have been here serving the community is what I call the other culture. The culture of people that immigrated to the United States, and not because they wanted to come and make their life miserable, but because, as you see in the screen, people really are living under conditions that are subhuman. There is not work where they live. The poverty rates are amazing. They are facing sometimes the cartels coming and saying, either you give us your kid for the cartel or we kill them. So they don't have too many choices. So with all of that, they have to face really important decisions of keeping where they live and dying of hunger, of violent things, of not having the resources that they need for them or their families, or taking the risk and coming through very, very, very dangerous conditions. Walking, just imagine walking all the way from South America here and all the dangers that they have to face. So it's not an easy process. It's not as they go to the embassy and it's very easy for them to get a visa even or documentation status to come legally to the United States. So some general characteristics, and again, very important, this presentation is just gonna give you some tools of how to work with the population, but by no means we want this to create generalizations or prejudice. You still have to talk to each of the patients and ask them if they are part of, what we are gonna mention, and I'm gonna tell you how I in general do it. So by and large, we are very family centered, and this is really, really, really important because usually decisions are made not in an individual basis, but many times with consensus of the family members. So this includes, if you're seeing someone that is pregnant, The decisions that the couple are going to make is not going to be up to the couple or up to the mother, but it's going to be really a lot of the influence of other family members. And this is actually a part of the culture as something that is protective, because we have a lot of people that are around us, helping us, advising us, guiding us, and that's how we see it. We don't see it as an imposition, and it's really support. And this family support extends to members of the community. So if sometimes you see people that come with the patients to the hospital even, that are not really family members, and you think, well, what is this person doing here? It's because it's part of that extended network. And now in the United States, unfortunately, many people do not have their close family here, but they have what we call the extended family, which is friends that are supportive of what is going on. We have a very strong faith. Still, many people has different religious beliefs, but still very strong on a superior person that is going to be guiding us, is going to be helping us, particularly in important moments in our life. So that is crucial to kind of keep in mind. We are very respectful. So if you tell us that you want us to do something, we might not go against your authority, but that does not mean that we are going to be happy doing it or that we're going to do it. So that's why it's very important to still create consensus with the patient and say, this is what I am proposing, but what are your thoughts on this? How would you want to go about this? For obvious reasons, and now more than ever, there is going to be much more distrust on the institutions. I mean, when you see that people that come to this country and have issues with, again, immigration, with not knowing the system, with not knowing who they can trust, initially they are going to take some time on really creating, a trust issue around people that they work. When you come, you basically almost lose everything. You leave everything behind except who you are, your culture, your language that is so rich, and is initially the only way you have to relate and communicate to other people. But by no means is like people make their life miserable and say, I'm not going to learn English to see if my life is miserable. Every English as a second language class in town is full with people that really want to learn more, better themselves, and help their families. However, also, if you have to come to the United States and have 3 jobs to barely made it here, barely send some money back home, sometimes you really are not going to have time to even do that, but really people try to do their best. And with that, again, there is a very strong work ethic. So many times in medicine, we feel that people are not compliant, they are not following the directions of coming back for care. And when we dig deeper, is because the kind of jobs that many people are doing do not allow them to really even take a day off to come for a visit. Um, all of this, as I was talking before, is going to be according to, obviously, in what situation people are. As I told you, there are 50 million of people that are citizens that have been in the United States, many even for centuries, families that have been here for a while. Most of the people that has been here for a while tends to incorporate in general to the the culture and everything. So they already know how to navigate the system, how to do other things. However, many of the people that we are serving have mixed households, meaning there are citizens, but there are also undocumented individuals. There are people that are undocumented that have been here for 20 years, and people that just came to this country and are seeking asylum and really, do not know a lot about the United States and the culture. So obviously, if you have a lot of money, it's going to be easier to come to the United States safer with a visa, and it's going to influence how is that you're going to get care. If you have a higher education, you're going to be able to navigate the system better. But unfortunately, again, many of the people that come here, the education level is lower, including the ones of their little ones. My husband is a teacher in one of the schools here. He is actually from Wisconsin, Caucasian, but he speaks Spanish. So he is in a program where all of the kids in his classroom are Spanish speaking, and then he helps them with acclimating to English and to continuing learning. And many of them come without any schooling, but because of their age, they are, he teaches fourth and fifth, and they are just put in these classes when many of them do not have ever, learned how to write, how to read, and the school system has to help them with that. Um, if you have been here again longer, that is going to be a little bit easier for you to navigate. And obviously, if you speak English, it's going to be easier to navigate the system. We have a lot of access to care barriers. You can see it in there. It's so interesting that about 52 millions in the United States speak a different language other than English. And about from these 32 million, the preferred language is Spanish. In Dane County, we have been very, very lucky, and I have to thank my dear sister Shiva Vidar-Silav, who started the interpreting service. So all what you see that what we are enjoying now, the having interpreting services at every hospital, either in person or over the phone, did not just come alone. It was the work of people really saying this is a human right for people to be able to communicate, particularly on stressful times, right? When you are sick, when you're having a baby, when you don't know what is happening, when you are receiving care. And now we have better access to interpreting services, but still we don't have enough people that are bicultural and understand where people are coming from. We have better services, but still, again, we are lacking more, and we need more Latine health professionals. Studies have shown that if you have someone that understands your culture, your language, the health outcomes are going to be better. And in this state, particularly transportation, right? We're talking about the situation today. So if you don't have a car and you don't have a good car, it could be dangerous to go anywhere. So if you see that a patient is not showing, there might be many reasons of why that is happening. The social determinants of health that we all know that play a very important role in medical care. So by and large, we are, the poverty rate is higher in our populations, the amount of people that are uninsured, the discrimination and abuse that people are enduring in the employment, and now with the situation that we're going through, even more. So people are going to start having even more fear of, participating in education, community, offerings, even going to classes. So it is gonna, if we already had disparities, the disparities are only going to be worse with this administration. So immigration status, I try to include things that will be important for you. So obviously people has to be careful about who they share their immigration status. And it's so interesting. People are so humble. They want to help. They want to incorporate to this country. They obviously want to help this country. So many times we have to tell the community, please be careful how you tell people your immigration status. Now more than ever, it could be dangerous. So in the healthcare, why is that we should ask that question? How is that we should ask that question? how do you document this? Because it's really important that obviously our medical records could be discoverable, and also the courts could request us to give these records. And how should you share this information? So why to do it? If it really is going to have something with making them eligible to a program, not just because you want to know or you are interested on their story and you just want to hear it, right? Even though they are very happy to share with you, but this is not something that we should be just asking for that. So the question will be is, I need to help you connect with services, right? So are you a US citizen, a permanent legal resident, refugee, or an asylum? No, I'm not. Okay. So you don't have to ask, are you undocumented? Do you have documentation to be in the United States? If you ask these questions, those are the questions that you need to ask, because those are the people that will be eligible for certain programs in the United States. In the case of obstetrics, up to today, we know that medical assistance, so bachelor care, will cover women that are in this country without an status. So if you are a US citizen, obviously a permanent legal resident and refugee or asylum, you just automatically might qualify for this. But not too many people know that even if you don't have this status, that you could qualify for medical assistance. So you can tell them, I just want to help you find a way to pay for your doctor visits. And I know that, we are not going to report this to anyone. This is just so that we can provide the best care that we have for you. And then in the documentation, it's very easy just to document this is an uninsurable patient. That's all you have to say. So, and because this patient is uninsurable, might qualify for medical assistance. You have to really have someone knowledgeable at your clinic or yourself to know what the parameters of medical assistance is, because there are some points in there that are important to know beyond this presentation today. And then also because you need to know what the term of the coverage is in case this patient is requesting, for example, a tubal ligation, because then they need to have appropriate documentation weeks before the delivery. And also, if you cannot do it when they are in the hospital, they might not have the opportunity to do it anymore because medical assistance will run out. So very important to keep in mind. So let's talk directly. Preconception, we still see very high rates of teenage pregnancy, even though you are dealing with people that were raised and born in the United States. They are being raised by a mixed Latine household. And again, the customs that we have in our countries might be different on how teenagers relate to each other, how parents are able to talk to teenagers about preconception, birth control, and all that. We are seeing a lot of single mothers for many reasons. Many of them travel to the United States before their partners could be here, or the partner is just behind and they don't even know that they were pregnant. It was a custom again by religion that you will not be having relations without being married. But now when you come to the United States, there are so many things that is difficult for many couples to get married. So they just elect to be together, but they are not really married. There is not really a history of preconception counseling. So many families have unplanned pregnancies that are welcome most of the time, but that still it wasn't thought of how to prepare for the pregnancy. Once they are pregnant, then it's very important again, sorry, to include all these that we're talking about, right? So who is going to be helping you during the pregnancy, after the pregnancy, uh, who is going to be helping you make decisions through the pregnancy, during labor, and after. Is definitely a very caring experience. We really like our babies and care for our babies for the most. However, again, we need to keep in mind that situations are very difficult for some of our immigrant families. And when someone thinks, for example, about termination, it could be very, very difficult. It's difficult for every woman, every person, every pregnant person, uh, particularly for us being, so religious, many of our families, that plays a lot into that and the decision. But at the same time, many patients also face the fact that they might not be able to really afford to have a pregnancy. So it's going to be important to talk to people about options in general. Just saying, I talk to patients about options. I see that maybe this was unplanned pregnancy. I just want you to know that these options are out there. If you have any questions, we'll be happy to talk about. We are very happy to, help you through this experience and to give you resources to this. In general, immigrants and people that have been in the United States shortly, because interestingly, after we are here longer, we start uh, getting sicker because we start adopting some of practices that were not easy accessible in our countries, like fast food. So for the most women in general yet do not smoke. They do not drink alcohol or drink very little. There is not really a lot of use of drugs. And particularly, again, all of this is even more once someone is pregnant, they really try to do what is best for their baby. The partners actually want to be very involved with the pregnancy. However, back home, there were not a lot of opportunities to be involving the partner because usually, even for delivery, there are no rooms where people can be together. Once you tell them that the partner is welcome and that they can be at every visit, they can obviously be at the delivery. The partners become actually very, very active on prenatal care and else. And then we tend to have a large support network, as I was telling you, not only the family, but friends, the community that are going to support people during pregnancy and afterwards. So it's very important to talk to people again still about the importance of diet and medications. Many patients feel that the moment they get pregnant, they could not be sexually active. Many times they feel that they shouldn't be doing a lot of physical activity because it can harm the baby. So it's very important to say it's okay, your baby is okay. Ultrasound and what are the indications, and making sure to remind them that that's not gonna hurt the baby. There are some particular things that we have about cravings, so that people are going to crave certain things, and that the husbands are also going to have those and the symptoms. And actually, we know that sometimes that's happening to other cultures, but in this case, it's very interesting to the beliefs that people have about sharing these symptoms and these things. If you ever see a safety pin on someone, a red ribbon, this is because there is a belief that if you don't wear one of those, the moon can influence the pregnancy and you can have babies that are going to be having genetic defects. Um, and then there are some beliefs about how to determine the baby's sex with a chain that you move in the patient's pregnant hand, and that will tell you, obviously not scientifically proof, but people believe that. And then also the shape of the abdomen that could maybe tell you what the baby's sex is. So then during labor and delivery, um, many patients do not have really a lot of concepts. So I think in the prenatal care is going to be very, very important to talk about how labor and delivery is going to work. What options would they have for pain management, explore what beliefs they have around these things, reinforce that they will have language access, because obviously you want to know what is going on. um, Understand that if you have family members in there, even extended family members, is very important now with COVID and after COVID that has been limited. And that is really putting a lot of strain in some of the families. So sometimes they want to have their family even in the phone or in an iPad or something, just because this is a celebration for the culture to be there together. I remember for when I was pregnant and I was in labor. I know you're gonna think we're crazy. I'm a physician, educated. We had about 14 family members in the room. My brother is an engineer with NASA. My sister is a social worker. My mom is a lawyer by training in Mexico. So this is not an education problem or situation, but it is a cultural affair, really. Many patients might want to pray during this and might even ask you to join them into praying for good outcomes with the labor and the delivery. Hot and cold in many cultures, still in our culture, might be that the room is too hot and the patient is sweating, but they would like to have the room hot because the elder told them that cold will not be good for them or the baby. Many patients have been conditioned to have, if they don't have already high tolerance to pain, because they really don't want pain medications that could damage the baby or, that might reveal that the weakness on their part. And then they are very respectful, as we talked before, and very grateful of the care that we are providing. But we have to be careful again, because we really want to make sure that they are understanding what is going on and how to make decisions. In the postpartum, again, the hot and cold concept is going to be very important. The diet. So many people will have a special diet. And then one of the particular things for lactation, there is this concept that if you drink beer, which has the yeast, will increase the milk production. And I mean, there is some scientific beliefs around that. However, we do not want any alcohol. So you have to just be very clear and ask, do you have any traditions, anything that you have to do after delivery to increase or that you know to increase your milk production? And they are very happy to share with you, yes, my mother told me that I should drink this very thick liquid that is called atole, that might help me so that my milk will come sooner and my milk will be stronger. Atole is just a mix of milk with chocolate with other things, so that is safe, but obviously beer is not. Um, the they might ask you or not about medication. So if you offer medications and you see that they might be a little bit reluctant, it might be because they just want to make sure that they are doing what is best for their babies. In some countries, we're still using a binder because we feel that a binder will help you return to your weight faster and also help with the after delivery growth in your abdomen. Those could be dangerous. So if you see someone, you have to educate them that it might not be the best for them and why, and understand and say, I know that sometimes people uses this, however, they could be dangerous. Activity level, again, educating that is good to be active as much as you can. And we have something that is the quarantena, which is just the postpartum, where people know that for 40 days they should not have intercourse, they should not do certain activities. So again, depending what the situation is with each of the patients, you can talk to them about that. And then back home, we receive a lot of home assistance and support with a lot of the family members here. That is why it's so important to have extended support systems that might come and help this pregnant patient in the postpartum. So I'm going just really quick, and you have to think about people are so resilient now more than ever. My patients teach me so much about, how resilient they are coming to the United States and enduring a lot of things. We need to think about their health habits because that is going to keep them healthy. Think about the family social networks that we create or have naturally. We are very willing to adapt to a lot of situations, including employment opportunities. And in Dane County, we are very lucky to have a lot of grassroots organizations. You can see it in the screen and you can see it later in the presentation. But we are very, very well organized and we all communicate with each other to help. Particularly with Latino Health Council that I represent. We have been in existence actually over 30 years. We don't provide direct care or service per se, but we advocate for a lot of services. We have conferences, as you heard it before, and we are also doing a lot of mentorship for the next generation for the pipeline. So those are some of the activities that were mentioned before. The radio program we have been doing for 21 years to educate people about a lot of different topics, and we also give them community services and community options. So I do the medical part and some of my clinic partners, and then Shiva Vidarsi Lab help us with the community side. We allow calls so that we can see what is in people's minds. So what do we need? We need better data because in this country, having accurate data of how many people are here, how they contribute to this country, which by the way, we contribute a lot. Economically, we are a very strong economic force. Many of our people that are undocumented pay taxes, Social Security, and they never are gonna get it back. We definitely need to increase the number of Latine professionals. Hello? Okay. Increasing advocacy for services and definitely more collaboration with people at large. We know that we cannot provide for our own. We need allies that could provide for our people, and that is where you come in because we really need people to know more about us so that you can provide appropriate care for our people. So some key strategies: know your population. So this presentation is part of that. Know what assets, resources, who is the leaders in the community, what health education opportunities are already in the community, and how you could incorporate and help the community that way. Work with the family, not only the individual. Ask questions. Asking questions is very good. And as I told you before, check for understanding because some people will share their head. That does not mean they understood. That just means they respect what you are telling them. So thank you very much. I'm going to stop sharing. And again, I'm sorry that we went so quickly, but as you see, it's a topic that could be for many hours. And we just wanted to leave a little bit of time for questions. So I open it now for questions.
Thank you so much. I just turned the microphones back on in the room, so if anybody has a question, just shout it out.
This isn't so much a question as much just saying thank you, especially around the Badger Care enrollment. This is something I'm seeing in the emergency department for consults. We're seeing a lot of hesitation over wanting to enroll despite being eligible. So that knowing that that is written into its policies right now and knowing what language to use is extremely helpful. So thank you.
Thank you.
Thank you so much. I just wanted to, echo what she said. We really, really appreciate this. This is really, just so helpful to get that perspective. So many in the department really want to increase our cultural sensitivity, but a topic like this has been really, really helpful. We have recruited a new obstetrician gynecologist from the Latin community starting next fall, and I'd love to have some advice on how to get him best connected with all the work that you're doing.
It's already on the works. One of my former residents introduced me by email. So I am here completely available to talk to them and to start a conversation about working together in the community. And obviously this is so beneficial because having a member of your department joining forces in the community and bringing this information back to your department is going to be wonderful.
Good, that's great to hear, because that's something that he is specifically interested in. So we wanna improve those connections and liaisons.
Yes, we are always, we always welcome help and people, and we love to help people.
This is Laura Berghan. I'm from Associated Physicians. Can you hear me okay?
Yes.
I have been hearing that some of my employees who are from the Latina community are just really frightened given the current political environment. And I'm just wondering if you have advice on how we can reach out to coworkers, healthcare providers, of how we can show support.
So very important to communicate with the leadership of your clinics. There is a lot happening behind the scenes that you might not know, but your leadership might know. So Shiva Vidarsilav, who wanted to be here today, is not here with us because she's having obviously conversation and meetings about all of these, but she has been leading UW Health on the sense of the provisions of what is going to happen with offering services at our clinics. And actually what I have been learning is that this is not new. So UW Health and many other organizations already had guidelines of interaction with law enforcement. And they are just revising all of these and then communicating with each of the clinic managers about what will happen if you have any interactions with any law enforcement, and how to direct them on how to protect, if you will, the clinics, the employees, and the patients, obviously. So talk to your leadership about what is going on with this. The other place for your clients or patients is to direct them to the Centro Hispano web page in the resource area. We are centralizing all the information that is accurate, that is up to date, with how to have a plan, an action plan for your family, for people that you're working with. And we are directing everybody there so that there is no miscommunication. There is already a lot of miscommunication going in the media. So we decided to centralize it there, and it's really daily review, and there are so many resources. So I invite you to go in there to Centro Hispano resources, and they have it in both English and Spanish. And there are some cards that are going to be distributed at every clinic. If you want some and your clinic does not have it, you can go to Centro Hispano. Actually, Latino Health Council is paying for the printing for these cards. and you can request 100 or whatever you want. If we need more, we are gonna print more, and you can just have those. Yesterday, I had dinner with one of the medical directors at Access, and he told me that these cards are now on every patient room and at their reception area. So there's a lot happening, but as I told you before, we are very well organized. So just go to this webpage and you will have the up-to-date information.
Hi, this is Katie Sempene. Thanks for the great talk. Can you hear me?
Yes.
Okay. I just wanted to share, or maybe have you share your experience with for folks who can't access care easily, that share the health clinic. Is that it's something that several members of our department volunteer at, in case folks aren't aware of that option for patients to get care. Is that something that you're familiar with, Dr. Tellez?
Yes. Mm-hmm.
Yeah. Okay.
Definitely.
Just spreading
A
awareness.
great resource for our community. Because as we all know, the price of healthcare in the United States is very high. Many, as I showed you before, are uninsured. And having people like your group volunteer your time to serve a community need is very, very appreciated and recognized for us.
Yes, it's an absolutely wonderful program. And I think we'll stop there since it's 8:10 and we need the 10 minutes to get to our next activity. Thank you so much for joining us. We all learned so very much.
There
Thank you
was
for your
just
hard work.
quickly a message in the chat about doing other presentations. You have my email. I will be happy to talk to you and to assist on any possible way. So if
Thank
you
you so
want to
much.
share my email and this presentation, thank you very much.